Hi, guys, welcome to the very first episode of our SRHR podcast that is brought to you by Lonia Center for Youth. And I'm your host, Tariro Gurure. And it's going to be an exciting journey where we explore SRHR. So, this is sexual, reproductive health and rights, and also nutritional policies, everything that has got to do with our health, mental health beyond SRHR. And I hope that today, whatever I then say, resonates with someone out there. I'm going to talk about issues of disability, accessibility, sexuality, and everything that might be not comfortable for an ordinary or maybe able-bodied individual. As you know, I'm also a young mother with a child, and I also have a disability. So I'm going to be answering some of the questions and some of the misconceptions that have got to do with SRHR. So yeah, my journey, obviously, maybe for those that would wonder what kind of a person I am. So my advocacy journey goes just beyond accessibility. It's a voice for independence, and it's a voice for making sure that we are ahead and we are also participating. So in this case, in sexual reproductive health, right? So as you know that the Constitution allows us to start families, allows us to live freely, allows us to exercise whoever we want to marry, and also maybe recently with the disability bill that's going to be coming is very broad in the family value. It's very broad in who we choose, is very broad in who we want to engage with sexual without being discriminated, and also maybe being subjected to societal thoughts of saying, how can you be having sex with a disabled person? So maybe for context, I mean an inter-abled relationship, which means that my partner is very much able-bodied, and with that, people would always think, okay, so what was he thinking going there? Or did he have a wider choice? That's his choice, and you guys have to live with his choice of having us as an interabled couple. So interracial, intertribal. Ours is an interabled couple. So yeah, sexuality, the issue of sex, and knowing that you still want to have sex and all that. I want to talk about the misconception of society thinking that maybe persons with disabilities are asexual. They don't engage in sex, or they don't want to have sex, or they don't have feelings. They're just human beings that are just waiting for their day to die. That's a misconception. That's something that's not true. We're having sex, and you might see with the results, or you might not see with the results. But there's a lot of sex that's happening, whether it's uh, with knowledge prior or without knowledge prior. That's a story for another day. But sex is happening, and also maybe the issue of service providers in this case, where we want to talk about why is there no comprehensive information that is very disability inclusive. So when I want to have sex, or when I want to go for services at a local clinic, I might struggle maybe with sign language interpretation, or with communication with my sign language to a nurse or to a service provider who doesn't understand sign language, who doesn't know sign language in that context. And when I get there, I wanna say that I want ukuhlaba idepo, or ngifuna ukuba lamaphilisi. So I just want to get tested and know my HIV status. So the questions would be like, ufuna ukutestelani, or why do you need a depo, or ufuna ukwenzelani, kanti vele liyenzelani ukuganga. These are the questions that get asked. But the fact that I left my home to actually come, it means that I know what I want, I know what I'm here for. So yeah, these are some of the questions that service providers do ask ukuthi, kanti vele uzihluphelani nje ufaka khonoko, vele uyayenza yini khonoko. So maybe we need to a system, or a policy that does not discriminate based on maybe on disability or age, or sexism or ageism, whatever point would be discriminatory at that point in time. So I get to the hospital. So this is my journey. I don't get my periods for a certain point in time. But also, it wasn't really about me not getting my periods. It was about, but I can't, as women, sometimes you might just jump a month or two and be like, it's fine now, I get fine, and then your period is late, your cycles do change here and there, and you're not really worried. I'll be like, but then, your body, as a person, your body that this is me, but this is not me. You know, you're already seated on a wheelchair. Like, for example, for me, I'm already seated on a wheelchair, and at one point I could feel that I'm just tired. Of course, you get tired on a wheelchair, but I could feel that I was really, really tired, but I couldn't express what I was feeling because I thought, maybe I've been having long days, because it was also a time where I used to travel a lot, with work and things like this. So I'm like, maybe my body is just tired. This is a burnout, and all that. So I went to my favorite place at some point, and then I ordered a baby hack. What? One of my favorite. And then I ate that baby hack. So while we were dishing up, I asked my then boyfriend, who is now my husband, I was like, baby, pane chinji rugunwa zviri bed panapa. And then he was like, come on, man. This is like where you eat every day. How panganuwe anything bad like that? And I was like, serious. So I ate. I think when I was halfway, I was like, I need to go kunoruta. Like I felt nauseous, but it was hot. I mean, like, I don't know, 12, 1-ish lunchtime. So I just went into the toilet, and I just did my business, and then I came back. I was like, I'm not feeling well, and I was like, maybe it's just your body and all that. And then we said, we just ignored the fact that that is what was happening at that point. And then I discovered that I was pregnant, maybe 4 or 5 months there. That's a story for another day also. This meant that I needed to go to the hospital as quick as possible. So my local clinic kuyabhalisa, and my first instinct was, bazambuza ukuthi bengihlaleleni endlini, bazambuza ukuthi vele bengisenzelani khona, and I was right. I was actually right, because I was harassed by the very same people that were meant to offer me services. And when they offered me services, vele ubusenzelani khonokho kathi susasihlupha and all that. I was like, you know what? I cannot get my mental health be like this. I'm trying to just digest what's happening right now. I'm gonna have a baby, but at the same time, this is a local clinic, a council clinic, where they're asking me why I had sex, why am I pregnant, and that I'm going to be a problem within their system because they can't weigh me, they can't weigh the baby, and a lot of which they were also right, but they didn't know how to put it. I was like, you know what? Quick called a friend of mine, who is a doctor. Guy, can you please just recommend me within your circles, which doctor or gynecologist that I would go that would be with me until I give birth and all that. So I was like, I know of a guy. I went to a guy. It's unfortunate that we can't name names here and all that, but this is one of the best gynecologists that took me through my pregnancies, my pregnancy, rather my pregnancy, not my pregnancies, and all that. So when he took me through my pregnancy, life changed. That's when I realized that if you have money and you can go to a private hospital, go and just feel better. So the questions were, let's see, how long do you think you are, and discovering how long I was and my due date and how I would prepare that I wouldn't go naturally. But also the issue would be anxiety. My mental health was not really in place, where you have a lot of questions. How will I even disclose to my family, and all that, and also what will the society say when they see me? What will my friends say when they see me? I was like, you know what, whatever, man. I just need to see a therapist that would take me through this. So you'd see that everything is then interlinked. It's the healthcare service, it's the mental health, it's your body anatomy, it's your service provider. It's just your well-being. It's all interlinked to a good sexual reproductive health right and service that you get from the on-go. So for me, it's really about post having my child and all these other things. So now my child is a year old, and I feel there are a lot of things that would have been better in terms of service delivery and the policy that we want to bring out of service providers, of healthcare service providers, being acquainted with disability, being knowledgeable about disabilities, whether it's braille or sign language, or just how to interact and ask good questions that don't make me feel like I'm less of a human being or I've done a wrong thing by wanting to have sex at the end of the day, or by wanting to have safe sex and that is satisfying to me as a person. So I remember now that it was delivery day. This was the 15th of April, 2023. Everything was going fine. I had my baby around 5 there, recovery room and all that. I remember a nurse coming to me the following day. It's like, can I ask you a question? I'm like, no, don't ask. It's fine. I won't be offended. Like, did you really consent to having sex and having a baby? I'm like, what do you mean? Often when someone is disabled, they might be subject to abuse and rape and force, things like that. I was like, you're not being for real. Were you forced to come and help me here? Were you forced to do your duty here as a nurse? I was like, no. I'm like, exactly. I wasn't forced. That's why I'm here. I wasn't forced. I know I have a baby, and I know I am going to be an amazing mother regardless of my disability. Like, I know, please don't report me. Please don't report me to my superiors. I was just curious. I don't blame them. They are curious because these are also the questions that are within the ordinary people. So when someone says they want to ask you a question, it means babe lesibindi. So ukuthi bakubuza ukuthi kuhamba njani, kuzahamba njani, kutheni kwathini. So yeah, we want to interrogate the policies, the healthcare services, and beyond just being young people. I represent that demographic, young people. I represent young women also. I also represent people with disabilities. So we just want to tackle everything. So which is nutrition, and sometimes you find yourself where you don't even have adequate nutritious things that you need to eat to be able to have the breast milk to feed your baby. And they're like, "How uchago lakho luncane," and then tradition starts to come in. So there's a lot of things that we're going to tackle within our podcast that we're going to talk about. And also, if you have questions of the work that Lunia Center for Youth does, you can also just tell us in advance so that we can tackle it and talk about it in the next episodes that we're going to do and talk about. So until next time, thank you so much. This is Tariro Gurure, and do follow us on our social media pages, Twitter, Facebook, and also YouTube, which is Lunia Center for Youth. Goodbye.